involved with RSN for nearly 15 years. Support from someone who's been there makes all the difference.
Hey David, what are you listening to?
Kidney Talk, an online radio podcast that talks about kidney disease and the prevention of it.
Oh, cool. Where can I find that?
Oh, you can download it on iHeartRadio, Google Play, and Apple Podcasts.
Oh, nice. I'll definitely have to download that.
Shout out to Renal Support Network, the annual Renal Support Network essay contest. I won the Renal Support Network contest last year, the Warrior, and we are all warriors. So thank you. Keep on doing all that you do, and be happy and healthy and keep the hope. Thank you, Renal Support Network. Woohoo!
As a kidney transplant recipient, I find that having an actual publication like Kidney Talk is an invaluable resource for any kidney warrior at any stage.
RSN keeps me informed of kidney advocacy issues so my voice can be heard.
I'm really looking forward to the prom this year and meeting people who are just like me. Dressing up is super fun and all the activities are amazing. Can't wait to see you there.
Hi, I've been participating in the Renal Support Network 30-minute fitness Zoom classes. Not only have I lost 15 pounds, but I can also strike a yoga pose like this.
When I created Renal Support Network back in 1993, I had no idea the impact that I would have among my peers. An illness is too demanding when you don't have hope, and peer support, education, and knowledge are crucial to our survival. We have a great week planned with some incredible speakers, great information for you to share, learn, so we can survive and thrive with this illness. It's imperative. So stay tuned. We're going to have a great event, and a shout out to our corporate mission partners for making this happen.
Next, we're going to move to Helen Currier, is the medical science liaison at Rockwell Medical. Previously, she'd held the position of director manager for renal and pheresis services at Texas Children's Hospital. She's past president of the National Renal Administrators Association. She has more than 20 years experience ensuring compliance with accreditation, certification, and licensure requirements with the clinical services environment, including all these letters. Let me see: JCAHO, CMS, which is ESRDC, FCs, transplant, COPs. These are obviously medical things. I'm sorry, I don't know. And the state of Texas. And please welcome Helen Currier.
Thank you so much, Lori and the RSN team, for including me in your Hope Week. It's certainly a wonderful, wonderful honor. I think the most important thing about my background is that I've been proudly been a pediatric nephrology nurse for more than 4 decades. And so much I've learned from my patients and their families. And you'll be hearing a lot that is familiar. And so it's 10 things to help your child adjust to care, and really looking at from the parent's point of view, what you can do for your child. So the first thing is never give up. And so the quotes that are incorporated into this slide deck come from Caring Bridge, and that is a platform that you see in healthcare systems to share information. And they had a little blog, and I pulled some of these quotes from that. Just don't give up. You're going to have hard days. but you're going to have amazing days too, sometimes a little of both on the same day, and eventually the good days will outnumber the bad days. And hope is really important, and to keep hope alive. And, you see that Lori has named this Hope Week. This year at the American Society of Nephrology meeting, which is a really large meeting where predominantly nephrologists gather, but also other allied health, such as nurses, they featured kidney stars. And kidney stars are paired physicians and patients. And I was really, really taken because this session was dynamic, and all three of the adult patients had acquired chronic kidney disease in their youth. 2 during adolescence and 1 as a school-age child. Today, 1 is a researcher that is also in a PhD program. 1 is in medical school, MD, PhD, and 1 is a lyricist for the rapper Pitbull. It was really an inspiring session, and it gave me hope seeing pediatric patients that were living full lives, as adult patients, and teaching in a formal platform. Second is advocate for your child. And we've heard this today. The story on Caring Bridge was Juan seldom left his son Jackson's side with Judy pregnant. The young parents had to divide and conquer. And at 2 years of age, Jackson could barely speak. He could not explain what pain is, but as a parent, you know when something is not right. Don't hesitate to speak up if there is something of concern. You don't have to worry about hurting anyone's feelings. And so I think, advocacy is so important. I mean, we think of advocacy in legislation as providers. We're advocating for our patients, like in team meetings, we might be advocating. And as a parent, advocating for your child may be among the most important work you can do. Children, one of the big interfaces, or children who are chronically ill can also feel isolated at school. And so help them practice a short script so they can explain their condition to friends or classmates who ask questions or stare. And along with school advocacy programs that you can request, there are school reentry programs after hospitalization that are usually available through your child life department. And if you don't know your child life specialist, develop a relationship with that individual. And what the child life specialist is really keen about doing is taking language to the child's developmental level. And if your child is attending a public school, secure a 504 plan as early as possible. And I say that because that's frequently a barrier. What happens is when you're talking to families, they really don't want to label their child, but a 504 protects them, and then you have more options with that plan. Let them be regular kids. We've heard this over and over. And so this parent said, trying to make things fun for your child, try to keep them happy and smiling. Don't ever make them feel like they're sick. I think it helps for children who are sick to just keep going. They comment about actually decorating a hospital room so that it had some familiarity. When a child is sick, I think it's natural for parents to become overprotective, but try not to shelter your child or limit activities unnecessarily. For example, I have met children who have never, stood on sand or, played with mud and other things like that because of being sheltered. But on the other hand, some parents are overly permissive, allowing the child to stay up late or have extra snacks or not eat healthy. And just as a reminder, children really crave structure, and it actually creates confusion if you start to break your own rules. So as much as possible, if you can maintain a family routine, that is really, really helpful. It's particularly a challenge whenever your first child is a newborn and has chronic kidney disease. In the vein of letting them be regular kids, I can't say enough about being open to sending your child to a sleepaway camp that supports children with kidney disease. It can be transformational. Some of these camps are regional and others are national, such as Camp Okawina, that's outside of Nashville, Tennessee. But I have been attending Camp O since 1981 as one of the professionals that also serves as counselor. And I see children in a different way whenever I see them at camp. I watch those transformations. Children find someone that they can relate to and often, create friendships, and they can be lifelong. Other venues that are important for participation is to encourage your child if they're a transplant, encourage them to participate in the Transplant Games of America and the World Transplant Games. Scholarships are available. The World Transplant Games are going to be virtual in 2021. And so it's called 5K Anyway. And that group is so supportive of one another. I have, I've had the privilege to be a supporter and to take a coalition of children to participate in the World Transplant Games all over the world since 2013. And I can just set my watch for, one of the athletes running back to me going, Helen, you're not going to believe it. It's a 16-year-old and she is exactly like me. She also, had the same illness, prior to starting dialysis or having a transplant. And so, finding someone who you can relate to is so important. And having witnessed that, I really encourage parents to, step out of their comfort zone and to, you can take your child to those games and, or you can actually send them with other groups. Ask questions. This has come up over and over. And the quote from Caringbridge was, "Don't be afraid to ask questions. You're getting thrown into a world you know absolutely nothing about, and you're going to get a crash course in whatever the diagnosis is." And so, write the information down so you can refer back to it. And then one of the questions that, one of the lessons that I learned early in my pediatric career is that whenever a parent asks me a question for me really to pay attention. I can remember I was passing meds and, back whenever I was a graduate nurse, and the parents said, "Are you sure that's the right drug?" And it was liquid, and the parent noticed the color, and it was an antibiotic. And my mentor said, "Let's go back and look." And the physician had actually changed an order, but the pharmacy had not received that order yet. Now, in that case, it might not have been, something that would have caused actual harm. But something to note is parents often catch medical errors that your child's doctor missed, according to a U.S. study that suggests that families may be an untapped resource. And it's just there's a lot of moving parts in a hospital. And so none of us can catch all of these on our own. And so parents that are paying attention are really important for our team. And roughly 1 in 10 parents spotted mistakes that physicians did not, according to a study of safety incidents observed on 2 pediatric units at a hospital in Boston. And so parents just notice different things, and they can offer complementary information. There's no ill intent medical. We're always looking to prevent medical errors. So please help us and ask questions. Also encourage your child to ask questions about his or her care, just like Dr. Ferris mentioned. This is the first step to your child's future self-care. And I had this on there, but Dr. Ferris is the kind of the world expert on transitions to adult care. But as Dr. Camille mentioned, not everyone has a robust program like Dr. Ferris, and so have that conversation with your pediatric nephrologist about a transition to adult care. Don't wait until your coverage indicates that they will no longer cover in a pediatric facility. The other important thing about asking questions is, and Dr. Camille brought it up, is that so much time is spent during the initial diagnosis, but we actually need to answer questions all along the lifespan of the child that we're taking care of. Document everything. This was a quote from Caringbridge. I remember one had gone to the hospital break room to get a snack, and he met up with another father who told him, "Get yourself a notebook right now." So he wrote down everything, the names of the medicines, the doses, the times, the effects they were having. Basically, they were keeping track. And chronic kidney disease and the medical complexity of it really requires that you take notes, and then you can also answer questions and look back on your notes once you're home and you can't remember. I mean, those are even lessons that we learn as adults, and we're seeing our physicians, and then we are 1 or 2 hours from the visit and aren't really sure what we talked about, if it was really specific, like a dosage. So another tip: stick by your faith. If you believe in God and know that He's with you no matter what, in the beginning it might not feel that way, but God will take care of you all the way through. We see that faith generates optimism. It enriches interpersonal relationships. It creates support systems and enhances quality of life. If you have a strong belief, it can actually really carry you during the rougher times. And communicate. This communication is directed at a spouse or partner, you hear a lot of stories about things like this can either break you or make you. Don't let it break you. Juan and I had a close relationship to begin with, but this made us closer. Well, the truth is that there are many relationships that are broken as a result of this. So knowing that ahead of time and really, focusing on the challenge, think about how, you're going to communicate. And Lori mentioned grief and the stages of grief, guilt, sadness, anger. And sometimes that anger is displaced, and you might feel angry towards your partner, the world at large, towards your child, and all of those feelings are normal. It's important to work through it because it is a process. It isn't something that you just turn on. And everyone copes differently. There's no right or wrong way, and recognize those differences. When I taught home dialysis, I would often see, that one parent wanted a lot of information and the other parent was stressed by more information. They just wanted the bottom line and didn't want to know a lot of the background because that caused anxiety. And when I had that recognition, I would try to adjust training where, I would say, well, I'll keep, Mrs. L afterward, and we'll, go into a little more detail and, allow the other parent, to take a break. So it's important for caregivers to really recognize that. But it's also important for us not to blame ourselves, because there is no right or wrong way. One thing we do know is that studies show that parents who do take action and focus on the problem experience lower levels of anxiety and depression than parents who denied or avoided the situation. So the more you get involved, it seems as if the data supports that you have lower levels of anxiety. Communicating with your child, as Dr. Ferris brought up, that this is how the child prefers to get information. And many parents struggle with how to speak to their child about the illness. Make sure you're sharing age-appropriate information. Don't give too much. Again, talk to the child life specialist. Sometimes even preparing your child, like, when would you tell a 3-year-old that they were going to have a test? When would you tell an 8-year-old? The child life specialist is a wealth of knowledge about that. And so don't hide the facts, be as transparent as possible. And often, the child's in the room and hears the medical conversation. So it's important to be able to serve as a translator. And talk to your child about what he or she is feeling. Parents might be surprised at what aspects of the illness are most difficult for a child. I recently had a research project where I looked back at 10 years of poems that were written by children, predominantly school age and adolescents. And what they expressed in that burden of illness was really interesting. So one of the things, I can just recall immediately is this child who, in their driving routine in the car, went past a pizza place, and the marketing sign said, "Stop, pizza, stop, pizza." And the child talks about it in a poem about how that message really tormented them and tempted them to be non-adherent in their diet and really crave pizza more. So, talk to your child about what they're feeling. Your child's medical education will change with your child's developmental age. Again, I'm reinforcing it to know your child's child life specialist. And in some facilities, there are creative arts therapists, and remember that the arts can augment communication. We've seen journaling, poetry, painting, drawing, about how a child can express themselves. One of the things that, as I mentioned, I've attended games with a patient population. And whenever we travel, we live with one another for about a week and a half. And so there are lots of after hours conversations. And I was struck with how many young adults did not actually know what caused, they could speak eloquently to their, kidney disease and treatment, but did not actually know what caused their illness. And I particularly was struck by a very well-educated athlete who told me that his kidney disease was from chickenpox. And so, I was like a sleuth trying to figure out what his underlying illness was, because he was not, he was not a patient that I took care of, and he had been transferred to adult care. And so, he later mentioned that he was, self-cathing, and anyhow, just by some deduction, I realized that his diagnosis was posterior urethral valves. But, and a viral illness was what moved him from, CKD4 to CKD5. So it was natural for him to think that that caused his illness. So it's interesting. So keep that conversation going. Know that the child hears it best from the parent, and the medical team. It's a team effort as we all keep one another up to date. Spend time together. This is talking about the parents and a wedding anniversary, and they went to a restaurant while family stayed with their son, and they both felt so guilty from being away, but they knew that they needed time for one another. And I think that's so important to keep those relationships whole. And this mother was explaining how important it was. But the other thing, and I can't remember which physician brought it up, but if you have other children, it's also important to make some one-on-one time with them as well, so that they realize they're important. Help them figure out how they can be involved in caring for their brother or sister, because you really want to avoid, creating resentments, and really bringing, balance to your family time. Enlist professional help. Psychologists are trained to help you and your child accept and manage chronic illness. So even when things are going well, it's helpful to establish a relationship with a psychologist early on. So if new complications arise later, when a child transitions to adolescence, for instance, you have a familiar resource to turn to. And a psychologist can also help with transitions between treatment modalities, for example, from dialysis to transplant or vice versa. I can't emphasize this enough to establish a relationship early on. We see so many patients that are seemingly, doing well, and then they, for whatever reason, have a bump in the road. Often it is during adolescence, and to have that relationship with a psychologist so that there can be support is good for not only the patient but the family. And finding your support network. This parent says, our families helped us out a lot in our community. A lot of people were behind us, and they still are. And that, people tell them that they're praying for their son and ask about him. And the family felt comforted, and that their community was a part of what they were going through. This has been a reoccurring theme, but build a support network you can rely upon and help ease your load. And take the time to take care of yourself physically and mentally, eating well, exercising, staying connected, and not feeling guilty for taking time for your own mental health. It really benefits you and your child. Explore local support groups. RSN is just a gold mine of resources. There's just so much that RSN offers. And so look at all of those. And, it might be that today is not the day to really dig into it, but maybe tomorrow is. So, and then Rena D is a doll that the kids made where I worked, and you might not be able to see it in this projection, but she has green features. So they created her from top to bottom. She's just a little muslin doll. And she has a social network presence, both on Instagram and on Facebook. And so you can request to be her friend, and she'll accept it. There's a child life specialist behind her, but she really promotes wellness and was offered. I think Dr. Ferris mentioned, that patients didn't want to go online to learn more about their disease. I mean, children are always faced with their illness. And so Rena D, who was also named by them, uh, and is an ambassador doll, basically just focuses on wellness. So there's never anything said about being ill. It's just about making connections. And so find your support network, and I think you'll be set.
Thank you so much. Yeah, I don't see any questions right here, but it's great information. I love just the focus on kids. I feel like, as a parent, it's so needed, and it's so crushing when you find out your kid is sick, whatever age they are, but especially when they're young and you feel so responsible for them. One person said, "Thank you so much. I love the Rena D doll." It's cute.
I think there's a question about a 504.
Is that in the Q&A? Above there.
Okay,
Yeah, I see it now. On the topic of Education 504 plans, I'd like to comment that pediatric CKD patients should be able to receive 504 plans in private schools in addition to public. I'm both a CKD patient and a current special education teacher, and had a 504 plan in a private school as a child. It does require some advocacy to receive, but 504 plans can be formed through a collaboration between a private school and a local public district. Oh, I didn't know that.
I think that my hat's off to anyone who can get a 504 in a private school. And I agree that it would take a lot of advocacy. Certainly needed, though. 504s protect these children because you never know when you're going to be hospitalized or you're getting a kidney transplant, and just the time away from school can be used as a penalty, and so you really need that 504 for protection. Another thing to think about is, early in my career, I used to think that homeschooling what really robbed the child of potential exposure to peers. As I matured in my role, I was able to recognize when homeschooling was really necessary to get someone over a bump and through a rough time, so that they didn't have that vicious cycle of failure because they missed something. So look to the experts; they really do know. But it's always good to for your child to have the experience of having peers.
I didn't know what a 504 was, and my daughter, as I mentioned, she started dialysis when she was 18, but she was a senior in high school. She missed time in her senior year from school, and so we asked, the one class she was behind in was science, so we asked the teacher for all the assignments that she had missed, and she and I worked for weeks on bringing it all up and submitting it, and then he failed her in the class. I said, "How could you fail her?" And he said, "Well, it was all late, so she didn't get full credit." And I said, "You told us what to do. We were doing what you suggested." And he said, "Well," I said, "She started dialysis this year. I mean, this is the science teacher." And he said, "Everybody has problems. Everybody has excuses." So, of course, I went to the school administration, and they did a proctored test to make sure that she was able to pass that class, but they also fired him. So that was terrible. But that unfortunately, a lot of these lessons are learned the hard way. So it's great to have information to avoid those situations. Thank you so much.
I would like to add, if I may, a comment about 504 and IE, an individualized education plan. A lot of our patients have cognitive impairment, as you saw the pictures of, but it's silent and it hasn't been flagged. Also, about 30 to 40% of our patients have ADHD, which also goes under-recognized and under-treated. So we need to advocate for our children to be evaluated for an IEP or a 504 plan. We have a standardized letter that we give to all of our patients that have CKD and hypertension. Even if you don't have CKD and you have hypertension, you can still have cognitive issues. So we are pretty strong advocates of having the schools evaluate them for an IEP or a 504 plan. In terms of homeschooling, I trained in San Diego, I worked in Houston, and I moved to Carolina. And I think of all the places that I have been in Carolina, I see more homeschooling than I have ever worked with in other communities. And I didn't understand that because I'm a very strong advocate. Keep the kids in school no matter what. But actually, I had to learn to, as we've learned, we have to learn, and as we mature in our careers, we have to learn to understand who we serve and why things are happening, and not be so pragmatic and dogmatic about things. It turns out that in Carolina, the school system is not North Carolina is not as great, and a lot of the patients benefit from homeschooling. My concern was the social isolation, and actually, they have such a strong homeschool system here that they have a lot of group activities, so that patients end up socializing in a different setting with smaller groups, with similar cohorts of patients that are homeschooled. So it's not as bad as I had thought. I had this preconceived notion that it was badness, and it's not as bad.
That's great. Thank you so much. I don't think
And a shout out to our corporate mission partners for making this happen.